All right. Good morning, everybody. We are going live with a Reimagining Healthcare live stream. And today we're going to be talking about delivering online mental health care. And been very fortunate to get Dr. Natalie Flatt from Connect Psych Services in to have a chat with us and talk about just the journey of Connect Psych and what's been learnt in actually being a 100% online mental health care service provider, and covering off quite a few topics that go in and around the business model of being online and the lived experience, and some things to think about going forward as well. So I will get Natalie on right now.
Morning, Yianni.
Good morning, Natalie.
How are you
doing? Really well,
you?
Thanks. Yeah, great. Thanks for making the time today, Natalie, and sharing a little bit about your journey as well as your experience in delivering mental health care online services. So perhaps I'll turn over to you to give us a little bit of insight about who you are and what you're doing.
Oh, fabulous. Thank you. So my name is Dr. Natalie Flatt, and I'm one of the founders of Connect Psych Services. So we created Connect Psych Services at the start of 2019, which at that stage was one of Australia's first online e-counselling platforms, dedicated to working more with organisations under the Employee Assistance Program. And what differentiated us to other existing EAP services is that not only were we that we created more the online platform using different levels of communication, so the video, the voice, and also the live chat. But we also created, with our practice management team, the algorithmic matching capabilities. So, one of the benefits of online counselling is that we can work with clients of differing challenges, in anywhere in Australia. So, we have, an employee that might be in Queensland at the moment working with a therapist who is in WA, and it doesn't really matter about that time differences or that geographical barrier. So we're really focused on what we coined employee priority, and getting the best fit therapist for the employee's needs.
That's fantastic. And I guess part of the difference between, the traditional mental health care practice model is that you're completely virtualized. Do you want to talk us a little bit about how you're set up and how you manage a team of psychologists and counsellors remotely?
Yeah, absolutely. Look, I saw the need. I used to work in the education sector for about 10 years, and where I actually saw it was the rigidity of teachers and principals not being able to access at that stage their own employee assistance programs due to the nature of that EAP's flexibility and their I suppose their 9 to 5-ish open hours, and so it kind of came to me to say, well, why can't we create something that is a little bit more flexible and accessible for all industries? So Connect Psych was born, and I started to create. I used to work, obviously, and being a mother myself, working with a lot of amazing therapists over the years, and then also them leaving the industry and then becoming a bit more inflexible just within their day-to-day hours. So I said, well, if we could actually get you back online and back working with clients, excuse me, after hours and in hours that suit you, would you be open to that? And the psychologists that I had, that were in my direct circle said, absolutely. So that's where we started our little team. And the other co-founder of Connect Psych Services, Sasha Milinkovic, is also a mum. So we thought, we need to create something that is incredibly flexible, but on the other hand, bring on therapists who are also understanding that flexibility and that accessibility. So we started creating a team that didn't really want to work, I suppose, in the 9 to 5. I tried to create the opposite effect. And we did a bit of research and understanding about, the ethical constraints around online learning and the importance still of consent, being able to have an area within your home setting that is still confidential, that is still private, and also then being able to, have audio and visual and I suppose work with the good old earphones in, just to make sure that privacy is still contained within the one-to-one session or virtual session here. So that was where we really, started to create that little bit of a team, and my next, and so they got put on the side, and then we went straight into finding the best practice management software that was on the market, and I came across Core Plus, and Core Plus, me walking into being a little bit of the non-digital individual, going in and telling my vision, and the fact that that vision was understood and expressed, and was able to be visualized in a very quick turnaround time, to get our therapists up and running, was exceptional, and that's when we started to introduce and to create those algorithmic matching. So the beauty about the therapists that I was bringing on, I really wanted to create a real eclectic mix of therapists. So not just the therapists that are specialising in, in anxiety and depression, but I also wanted people to be expressing, to have specialisation in burnout, in compassion fatigue, in trauma, also in relationship counselling, in post-traumatic stress, dealing with personality disorders, dealing with different conflict resolution, performance anxiety, and emotional intelligence. And because I knew that if we created this eclectic mix of therapists, I could then approach a wider range of industries to be able to assist, knowing that we were still going to get the best fit due to the algorithmic matching that Core Plus was able to then help create for us. So that's that was what we found as our foundation, and since then we've really grown into a really neat, fantastic team who's very connected, and that's one of the real important and ethical attributes of even creating a private online or cloud-based clinic, where there is that connectivity between the therapists, because we are Australia-wide. We don't want to lose that connection, because we don't really have that face-to-face supervision and peer supervision. So we create weekly and fortnightly and monthly even catch-ups, just so then the therapists are on board about what we're then doing from a development and business development aspect, and the new companies that are coming on board, and a little bit about them. But we also have created what we class as Connect Psych College, which is our own online repository, which beautifully, our practice management software is able to hold those documents as well. So it's that shared document storage and repository, especially in the areas of COVID-19 at the moment, to be able to provide all our clients that we're working with that I suppose consistent level of information, knowing that misinformation is actually one of the biggest anxieties right now that are coming our way from the clients. So having that connectivity between your therapists is also really important, and being able to have that that capability on your platform is I believe imperative.
Thanks, Natalie. That's great. So I guess there's so many layers to this. Then the tech is part of it, but at the end of the day, it's how the people work are in and around the tech to deliver a service to a client. And
absolutely.
And so, from your point of view, you've built a very cool-looking website, Connect Psych Services. It's very contemporary, very modern in its movement and its engagement. And part of the logic there is to actually get that journey started, so that when somebody is wanting to engage with support and reach out for some access to mental health, you've got two pathways that have been built. One's for an employer, and one's for an employee. And even though there may be mental health providers listening at the moment who perhaps don't do EAP and concentrate on private clients. I think the logic's the same. You've got to sort of think about the journey of what it's like for somebody to actually make that decision and not get caught up by the tech, not actually be impeded from getting access to healthcare because of the tech. Do you want to talk us through the online journey that you've created with Connect Psych Services?
Absolutely. It's so important. You're so right, Yianni, that everyone becomes really intimidated by tech, especially with different cultures, and also with the elderly. They don't feel as tech savvy. So we tried to keep that in mind when we were building it. So what we create with look, obviously, as what you just said before, we originally started with EAP. We're trying to evolve with the times as well, and with the opportunity of telehealth, Medicare rebates coming on, we're also utilising that capability as well, so we can then assist GPs with another referral pathway. But as you said, yes, exactly, Yianni, it's going to be the same pathway where we're able to individuals are able to come onto our website and to basically click Connect, book an appointment. So that they go into a section of the website which says, well, at this stage it says employees and individuals. They click Connect, and that will send them through a pre-screening capture of a number of questions, just so then we're getting the understanding about what their current concern and challenge is. And this is a very intuitive way of capturing the data, the tech data. And once they go through these questions, really simple questions, when they click Connect, that then will send through the algorithmic matching and align them with the top 3 therapists to suit their current needs. They can have a little bit of a read of the therapist and say, look, okay, well, I like the look of Joe. So they click on Joe, and up comes Joe's appointment times. And so they can then click on the appointment time that they really want to work with in Joe. And once they click it, the software does the rest of it. That will send them an email and an SMS, and also some information on what to expect in the first session. So we're trying to equip these and give the prompts to the individuals along the way to reduce that level of intimidation. We've also created an app for those more tech savvy or on the move individuals, not really on the move right now, but just to make it that little bit easier. What we are finding through our data analysis as well of onboarding and the times that individuals are onboarding, it's normally between 7 p.m. to 10 p.m. we're seeing a huge influx, and also between 2 a.m. and 4 a.m. And to me, this is actually showing that the level of anxiety is starting to heighten within the community and within society. And you know, that they can be waking up in the morning or early in the morning and saying, you know what, I've got to do something about this now. So creating an app where, you know, a phone normally is a bit more accessible than a laptop. So being able to grab their phone, clicking onto the app, and that takes them through exactly the same process as if they were on the website, and they're still able to then access and book that appointment time, and hopefully feel that level of control to go back to sleep, knowing that when they wake up in the morning that they have got something put in place within that 24 hours. So it's that instant accessibility, which is great.
That's fantastic. So that's a really seamless intake experience where, well, you're doing two things there, aren't you? You're doing the intake process where you're making it as low barrier to entry to allow somebody who wants to reach out and access mental health care services to be able to go through a seamless digital healthcare access experience. And then you're also doing some matching in the background, and that's kind of some stuff that Connect Psych Services is doing a little bit differently than perhaps a lot of private practices would be contemplating doing right now. And I want to separate those two things because for the private practices out there that are wanting to respond very fast and using telehealth, the type of sophistication that the matching algorithm has is unique to your business model, and not something that's as readily available just by using telehealth tools out there, or perhaps even non-health tools, you know, like Skype or Google Hangouts, or even the free version of Zoom as an example. They're kind of good for the video consult, but they don't actually think about the beginning of the journey, and so what happens leading into the appointment and what happens after the first appointment. as well. So I think that intake and matching process is a really important thing for people to think about. The intake is fairly easy, and and Core Plus offers that through the online booking capability, and it allows some documentation to be presented to a client, to fill in and register, and that can be customized in any way, shape, or form. So that's kind of low-hanging fruit for a lot of private practices to be able to deal with it. Beyond the matching now, you've got a remote team of psychologists and counsellors operating from different parts of Australia. What's the next part of the journey then? What can practice owners think through beyond actually getting the first booking? What's the next step in the online telehealth kind of model, that through your experience?
Yeah, I thought I'd just mention as well, like, just because of the telehealth coming up, with the mental health care plans, and we're opening that opportunity up for those individuals. Finding a platform that's also being able to have that secure messaging between clinicians can be really important. What we're going to find the influx in, like, we haven't really. I don't believe that we've actually seen the huge mental health influx, especially with COVID right now. I think that now, as in Australia, is moving more into that lockdown phase, moving more into that altered way of working. Homeschooling, isn't that fun, everyone? And we're trying to adapt to this new environment. We haven't really. The mental health challenges are starting to now come out, like it's starting to become to the forefront, and we're seeing that in the next couple of weeks to a month, I feel that we're just going to get a huge influx in this. Now, we are obviously seeing the level of acute stress coming up, and we're seeing the level of anxiety. We're very concerned about the individuals who are displaying symptoms of depression or have a diagnosis of depression with the level of self-isolation. So that is obviously a huge concern for us. Unfortunately and heartbreakingly, we're already seeing a rise in domestic violence because of obviously being in the same area, and that's devastating, and we're trying to assist and refer where we can. We're also then going to be seeing a lot of post-traumatic stress also come out of this. So the pre-existing mental health issues are something really important for our therapists to also know. And if they have access, and if they've been working with their GP, and a lot of individuals still do, they still work, they still really trust their GP, and their GP knows a lot about them. Being able to have that consent to share some of that information really does help our therapists know and be able to continue that level of support, knowing that the GPs are very much inundated right now. So having that level of secure messaging for patient info is, I think, a really good capability for practitioners out there and clinics out there who want to set up that practice management appropriately, and that online, clinic. So I suppose I just wanted to add that bit in there, Yianni, that I feel that's really important just for continued support. And as I was saying before, is that we are all the frontline workers. So as we see the mental health issues rise, we have to protect ourselves. It's very concerning right now, all those amazing nurses out there doing a fabulous job. And, it's something that we have been also supporting a lot of those hospitals to be able to provide that level of relief and that level of mindfulness and self-care and anxiety and relaxation techniques and cognitive behaviour techniques for those nurses, for them to keep going and to keep doing that amazing job that they are doing. And also the expectation of really what's to come. But with the therapists coming on board, we also have to manage that expectation. We have to watch their level of compassion fatigue and their level of burnout. So having a community that is all very connected and that also then is reminded of their own level of self-care, their own level of structure and still incorporating family time, which is so important, and having their own level of boundaries around them, including their own nutrition and exercise. we still need to be reminded of that ourselves. So that's something that I feel in the current situation I've really been more mindful of when I've been working with my team, just to doing those check-ins, just like a manager does within their companies of their own team. You have to check in with your own. So please don't forget that if you are setting everything up. I know that it's really frantic right now and trying to set up that online cloud, and you've got all the tech to look after, and you've got to worry about the ethics and the new consent forms and the privacy acts and whatnot, and knowing that you're going to be going on onto a platform that is going to be still able to have the correct bandwidth as well, to have that reliability of the sessions. But don't forget about the people who are going to be imparting all this amazing support, and just make sure that they're okay as well.
I think it's really good advice. It's, COVID-19 is a watershed moment that is affecting everyone at the same time. And so I like to say to people that we may be scrambling at the moment in reacting to it, but the work won't go wasted when we get past COVID-19. What will happen is we'll actually start to see an augmentation of the traditional in-practice, in-clinic type healthcare service delivery model with online. It's already been starting to happening. There hasn't really been a strong enough driver from perhaps the practice owners themselves and or the clients to actually move to online. But now we've got that event, and I think what we'll find is it sets the groundwork for a modernized version of healthcare beyond COVID-19. And I think there's something really powerful about that idea, and embracing the opportunity and not necessarily seeing it as a terrible kind of scenario that we're all sort of going through. It's a pivot. In tech terms, we call it a pivot. There's new information. We need to meet it. We need to respond to it. And if everybody needs to stay home for a while, they still need healthcare services. They still need to access healthcare services. So one of the premises of digital health, which I talk a lot about, is that we want it to empower individuals and providers towards better health outcomes. And you're using digital environments to actually facilitate that connection. And that's literally what the prefix tele means in telehealth. It basically means from a distance. It means, it derives from a Latin word. So it means we are delivering health from a distance. We're delivering healthcare from a distance. And that can be done through video, through voice, through chat. It can be done through devices. There's so much opportunity to actually innovate. And we don't have to do it all at once. Right now, the video side of it and starting to build that virtual clinical governance model around it is key. But in 6 months and beyond, we can start to see some other benefits of having established that relationship with clients where they're now comfortable and used to dealing with it. And on the other side, as you rightly point out, also the practitioners themselves are feeling comfortable and used to the idea of being able to deliver
absolutely
via video modality.
We're also seeing exactly what you're saying, Yianni, is what's called the online disinhibition effect, or the benign online disinhibition effect, and people starting to become used to talking online. They have that distant barrier, and they can actually find that they feel a lot more comfortable in talking about their issues because they're in an environment that they feel safe in and that they know, and they might have their cup of coffee next to them, and they might have their pet next to them, and they can feel they can open up a lot more. And we're seeing this in more male mental health, which is fabulous to be able to see. And so having that level of honesty is and breaking down that barrier is actually, we're finding that it happens quicker online than it does face to face. So you're taking away not only that distance that can be quite intimidating to some people, but also the clinical environment that they also find quite intimidating as well, along with being in a waiting room, getting there, the travel time, the stress of doing that. So this is where the online therapy it's certainly moving, and it's individuals also want to be able to access. We can become time poor, can't we? So we want to be able to access someone who understands our needs straight away. And look, we're trying to create I can't say we're the silver bullet, but we're certainly trying to create that best fit for therapist to client as best as we can through this algorithmic matching, and we're seeing some great results so far.
So I take it that retention of existing clients would be a big priority right now. Would you agree that would be the sort of the general gist of things at the moment in kind of taking the COVID-19 situation, responding to it, is what do we do with our existing clients?
Absolutely. So we need to be able to, just obviously checking in and making sure that they're okay. We've just gone through a lot of our list of clients who might have actually connected months ago, and just a basic like check-in, just checking in to see if you're okay, how you're coping, and knowing that the access is still there when they need it. So kind of doing that reach out, which is far easier doing it online, through a really like a more of a self-care strategies email, and then some self-care tips about how to deal with this unprecedented time. So that's been a bit of a bonus, because with telehealth and with the practices, a lot of the clients can then reflect upon certain strategies that have been provided, because we're utilizing email systems and live chat. So that's, again, a bit of a bonus that they can go on and be a little bit more self-reflective, for them to then know, and they have the accessibility to be able to connect at any time, anywhere, and not, again, have that travel barrier, or that time restriction, because our staff work from 5 a.m. to 11 p.m. At the moment. We're really being able to capture a lot of people, everyone's needs right now. So we're trying to, for the individuals who are coming on, we are encouraging them just to keep on checking in, and making sure that they're okay, and being able to just set that expectation with them that things are changing on a daily basis, and it would really be good just to keep up the sessions that we can connect at the end of the session to book into the next session, knowing that they can freely move that as well if some drastic things change tomorrow. And no one really knows what's anything concrete. We really don't know what's going on and going to happen tomorrow. So we're really lucky with that flexibility of the hours, and our therapists have been unbelievable, because they've made themselves a lot more available than they traditionally were pre-COVID.
So that's kind of some really good practical lived experience guidance and advice, Natalie. So thank you for kind of sharing your own kind of suggestions and I guess where you're at with your own experience with it. I guess to summarize, there's kind of it's probably three broad key things I took away from that, and one is that we've got to have a mindset to be able to actually move with the times, and the times right now are heavily dominated by COVID-19 and the impact on people's ability to move around physically. And so a response to that would be to actually deliver online services to the extent that you can, and perhaps even experiment if you think you can't, and just try it and explore that possibility, get a lot of feedback from your clients in terms of their needs as well. And that's focusing on the retention side. And in order to do that, it's important to have the right tech in place that is still supporting the clinical governance that's needed for things like data privacy, the clinical workflows in terms of case file management, and being able to communicate with other points of care or referrers through secure messaging channels. And I'm glad you made that point, because secure messaging is, I think, really critical right now, in addition to video, because we don't, we can't actually have somebody walk a piece of paper into our practice, so how's it going to get? And so, yep, maybe email, but that's not secure. That's that has risk associated with it. But I think more conveniently is most GPs in the country have systems that are integrated into the secure messaging communication channels, and a product like Core Plus has already integrated all those GP systems. And so the GP now just needs to look you up and do a referral, or alternatively be told by the client that I'm seeing Dr. Natalie Flatt, for example. So then that GP would then look up you and be able to find you and send that healthcare information directly into your practice management system. So I think that's an important thing to respond as well, is to think about retention of your clients, but also retention of your referral relationships as well, which will support extensions of any care plans or treatment plans that are in place, and potentially new clients being referred to you as well. So I'm glad you made that point. And the third one that I took away from it was just the way you organise your culture around the model of online healthcare, and looking after the interests of the individuals, the practitioners, the counsellors, understanding the potential impact on them as well. I think that's kind of been lost a little bit in the recent weeks. There's been a lot of retention's definitely a big one. Using video in some ways, definitely a big one, but also recognising that the people who are delivering the healthcare services need support through that process as well. Is that a fair sort of summary?
Absolutely, that's great.
I'm an active listener, Natalie.
You're an active listener. Do you want a job, Yianni? No.
Well, look, I'm partial to mental health care. I think it's really important. Everybody should have a mental health care support as part of their healthcare team going forward in their lives. I think that's just as important as nourishing yourself properly and doing a bit of exercise, I'd suggest anyway. So what else can we take away from the experience at the moment with Connect Psych Services? I've noticed that you've got a good model. You put a lot of frequently asked question type information on your website, and you personally have done a lot in the research area. Do you want to talk a little bit about research in the effectiveness of telehealth? You already talked a little bit about how that disinhibition effect comes into play once people try it once, twice, and they start to become more comfortable and accepting of that environment. What other type of research is in there?
Look, it's basically what we're trying to create. There hasn't been a lot of research in online counselling. Like, this is actually quite new worldwide. Like, we're probably in our 4th or 5th year of the appropriate online counselling, e-counselling, just due to the security measures and the Privacy Acts, but then looking at the accessibility, and really the shortfall of the face-to-face psychotherapy sessions. Like, psychology and counselling do need to come up with the times and move that bit quicker, but we've had to do it in an ethical and legal manner as well. So it is relatively new. I am quite passionate in this area. I do have quite an academic background, which is actually more in the anxiety disorders, but it's been really fascinating. I'm very much an advocate of incorporating academia and intervention and building that bridge. So I still have a very strong connection with Monash University, and I actually work a lot with Masters of Counselling students and supervise them. Monash University do have their whole an e-counselling research area that has been, it's quite new. So what we're trying to do is develop quite a bit of data at Connect Psych to be able to look at the efficacy of online counselling within Australia. So that's actually, that's going to be quite pioneering. So I'm really excited about doing that, and then working with some Masters of Psychology students again, and hopefully co-authoring some papers. That's probably why, with the pre-screeners, we are trying to look at the level of distress a client is displaying before they come and see us, and then being able to have those sessions, and however many sessions that they feel comfortable with the telehealth, we'd love to get them to 6 or 10 of those sessions. It is under COVID, so it is going to be a bit that kind of skewed data, so we might put that aside, but especially within the employee setting, they're getting anywhere between 3 and 6 sessions once they close off on those sessions, and those sessions being complete, and they're doing, they believe that they're doing quite well. They are then sent a post screener with very similar questions as was on the pre-screener. So then we're able to get some great data to look at the efficacy of what has been worked on within those sessions, and a new, I suppose, a little bit of a world first. I won't say world first because I'm not I'm not 100% sure on that. But one of the other variables that we've decided to include is the therapist's interpretation of what they believe has been going on for that client. And the only reason we've been able to do that is because of the practice management software and the way that all our data and our case notes have been contained on a secure platform. So that's super, super cool for me. Because being able to see what the client's interpretation is of their problem, and then what's or their challenge, and then what the therapist is seeing, and being able to see if there's an alignment or if there's a bit of a disconnection, is really going to give us a lot of information about level of self-awareness. So so it's exciting times from even a research perspective in the coming months.
That's great. So, and you made a comment earlier that you think the wave is yet to come, in terms of this COVID-19 response. So, I guess that's, item codes are being now updated and released. I know there's a little bit of mixed feeling in the community around whether the fees are enough at this point in time. But where do you think it's really going to ramp up? And I know nobody's got a crystal ball exactly, but what would you suggest? Where's it at?
I would suggest in the next month. I reckon by the time we hit May, June, I'd hate to say, like follow the curve, because the curve will probably spike up again. And obviously all our hospitals are trying to prepare for that at a rapid rate. But I feel that the more we go into this level of self-isolation, whether or not we move into higher stages, and creating a habit where, we're social beings. That's what humans are. And to have that restricted on us is going to start, the cracks are going to start to show. So I feel that the mental health is going to become at the forefront now. What we are trying to say, and what everyone is trying to say, is keep connected, stay connected with your friends, your families, your colleagues, and just ask, are you okay? And really for each individual, each practitioner, or anyone, just even have that understanding of the best referral pathway, and or someone to call, or someone to gain that support is going to be imperative, because unfortunately, even when the infection is over, we are going to see some long-standing mental health challenges that are going to come out of that. So trying to remain and get some strategies for yourself now to keep your resilience up during this time. You're going to be far better fit to come out the other end.
And also some predictions that things like domestic violence and other consequences of being at home the whole time are expected to rise quite dramatically.
And unfortunately, we're going to see a lot of relationship strains, a lot of conflict between spouses. Unfortunately, it's part of the package at the moment. We're trying to mitigate that as much as possible, and keeping communications, and trying to even have that, separate time, if possible, even within the household, where even if one spouse can take the children for one bit and let the other go and meditate, or, have a bath, or do some form of self-care, even if for an hour or two, that really does make a difference. And then being able to swap it, and then, one person taking one child, the other one taking another, and having that tiny bit of separation where you can, is going to be able to keep the family cohesion at a relatively calm level. So I mean, schooling is obviously the iffy area, and whether the kids are going to go back in term 2 or term 3 or at all, that's causing some undue stress a lot on parents that we're working with. So we're just trying to say, remain realistic. Don't try and overexceed. If you've got if you're going to have some great days, you're going to have some not so great days, but you know what, tomorrow is another day. So even parking whatever task or project you needed to do, doing some level of self-care, going to bed earlier, waking up, starting again the next day, that is going to be what builds resilience.
There's a couple of questions I was making along the way. Is that so the coverage window? What do you think? Should a practice owner be thinking about extending their coverage window with telehealth? In other words, they might have had a 9 to 5 or 8 till 6 or something along those
Absolutely.
lines, 5 days, 6 days. Should we be thinking about changing the coverage window now to offer some different coverage window? What would your suggestions be?
If you wanted to create a bit of a successful clinic, I would be creating that window as wide as you can. That's where I really started when I talked about when I started to recruit, the flexibility of the therapists that we wanted to bring on, and that's why I started with mums. Because they actually need to be quite flexible, and they really enjoyed going and having the after hour sessions after the kids are going to bed. And we work pre-COVID, working 9 to 5. A lot of the time we're on autopilot. We're trying to get through the day. We've got all our tasks lined up. We then come pick up the kids. We then create dinner. We can do that. And especially around 7 o'clock when things are quietening down or our mind's starting to quieten down, that's when our thoughts can start to come to the forefront. And so we have a huge influx from our data of our sessions ranging from 7 p.m. to 11 p.m. So that's a huge window. And for anyone successful, I would have that window. If you can start with something, start with that window. Being able to even go from 9 till 9.
Yeah, that makes a lot of sense, and that might actually, and not to suggest people are working 12 hours a day, 7 days a week, but there's an opportunity to reimagine your business model, where you might say, look, most of my clients, from a retention standpoint now, it suits them to have access, very early in the morning. It suits them to have access later in the evening, and so you can kind of think through whether that coverage window could make a difference in terms of retention and potentially even the way that you receive new client referrals and or bookings through your online systems. And yeah, we're no longer physically constrained. So with that, there's also something quite liberating. And those of us in the tech sector, we've been working remotely for 12, 15 years, probably longer. I started my first remote business before Core Plus in the early 2000s, and it wasn't as easy to do as it is today. So there's a certain mindset that breaks down, like when you no longer have to be somewhere 9 to 5, you can actually now integrate your lifestyle into your work plans as well, and have a much more personalized fit in terms of what makes sense for you. And so I really think that value proposition in terms of your own recruiting strategies, Natalie, would appeal to a lot of people. And especially now where potentially larger practices may be thinking about what they do with contractors and potentially with employees, where they may be thinking that they need to release some people, potentially scale things back, stand down, whatever the appropriate kind of response is for their own business continuity. So that would mean that there may be psychologists and counsellors out there who are available. They've got time on their hands, and they could potentially work with organisations like Connect Psych Services, or perhaps others where you've already developed the telehealth capability, you've developed the remote working culture, you've got your systems, you've got your clinical governance, your library, what was it, the university
Connect
or college?
Psych College, Connect Psych College,
So what would you say? What would you say to your peers in the industry about
please give us a call, get in contact with us. We'd love to hear from you. We're still, we had this amazing, emotionally intelligent team and community of therapists right now who are really welcoming, and I want to create that team. That's so important. So the door's open. Yes, we don't know what's going to be coming tomorrow, but I think that we can certainly offer some work and some flexible work so please give us a call or send us an email, and we can be in touch. And I think also, just to add to that, the flexibility of the hours, Yianni, it's more also about the flexibility of communication which telehealth can provide. Not everyone wants to be on video. Not everyone may be comfortable on video. Telephone's traditional. That's what's going to help with the elderly. That's what they like. That's what they were used to. They weren't used to this mobile application. So being able to have a communications platform that encourages video along with telephone telephone, and if you can, even the live chat. We love the younger generations. They really enjoy it. We see a lot of that in retail and hospitality, where we've brought on therapists who are very comfortable in working with live chat. Obviously, there are some constraints around that, and being able to watch, and to have appropriate language that is quite objective, but is also very proactive as well. For those individuals who enjoy that style of therapy. So having open different types of communication is also going to be an advantage.
So I guess another set of summaries there is that as a practice owner, it can be done. It's really just a mindset. You can pivot the practice to be online. You've got your pre-existing clients to retain and discuss with them how to actually how they would like to actually transition into online services for at least the short-term COVID-19 timeline, if not further, and really get that feedback. Really sort of understand what their coverage window expectations might be, what would work better for them, and work with your teams. And if there are individuals out there who are no longer employed or able to work under their traditional model up until now, there's a possibility of being able to actually get placed with established online mental health care service providers like Connect Psych Services, and be able to do that from the convenience of your own home. Is that a fair summary there,
Absolutely.
Natalie?
Yep. Perfect. Thanks,
All right.
Yianni.
Fantastic. Thank you, Natalie. Is anything else you'd like to add just in the 1 or 2 minutes we've got left?
Be gentle on
How
yourself.
are you doing? You doing all right?
It's hard. Like it's be realistic. Yeah. I'm very much like that. I try and practice what I preach. I try to lead by example. Some days are easy. Some mornings are easy. Some, as I was saying to you before, Yianni, like my son just poured paint all over my good chair this morning, and that was at 7:30 this morning. And when I wanted to sit down and do a bit of work, but no, I was pulling paint off the wall. Like it's just, if you don't take it with, if you don't take it in your strides, it will create that level of stress and resentment. And that's something you need to accept, that we are in a temporary standstill. Yeah. And we have to remind ourselves that this is temporary. We will get through it. We also then need to put things in place to make ourselves and to protect ourselves and protect our resilience. And still don't forget to self-care and be gentle on yourself when things don't go your way.
Yeah, I think that's really good advice. Dr. Natalie Flatt, thank you very much for making the time, for expressing your own lived experience and personal anecdotes around providing online mental health care services, and just as a human being in dealing with the limitations on our lifestyle at the moment, and being able to adapt and work with our partners and our families, and kind of see what we can get out of it in a positive light, as opposed to focusing on negative. So I really appreciate that. Thank you. And I'm sure there's a lot of value for viewers, particularly in the mental health sector, on being able to embrace the idea that it can be done, and it should be done. And there's more to it than just video. There's actually your whole business model now embracing the online, in addition to the established clinical model that you've got. So I think there's a lot of good insights and advice for people there. So thank you once again, Natalie.
Pleasure.